Hello everyone, welcome to the video. In this lecture, we will discuss about the routes of drug administration. I am Dr. Ritu Singh, Assistant Professor, Dravagun Department in HMC Dehradun. So, let's start with the slide. In this flowchart, you are seeing this. The routes of drug administration are divided into local and systemic routes. The local route is further subdivided into the topical, deeper tissues, and arterial supply, whereas the systemic route of drug administration is divided into the oral and parenteral route, and the parenteral route is of two types, injections and other routes. So we will discuss about the local routes of drug administration here in the next slide. The topical routes of drug administration are the application of a drug directly to the surface of the skin. So any drug which is directly applied on the skin is known as topical route. So this is also called the local route of drug administration. In this administration, the drug is introduced into the eyes, nose, ears, lungs, vagina, urethra, and colon. These are the routes of drug delivery like ocular, nasal, sublingual, vaginal, transdermal, pulmonary, oral, and buccal. The topical dosage forms are in skin and eye, ears, nose, and lungs are the creams, ointments, lotions, gels, and transdermal patches are applied on directly to the skin. And in ear and eye, we have used the ointments, solutions, suspensions, and in nose and lungs, the drug used is the sprays and powders. Now we will discuss about the advantages and disadvantages of the topical route. See, here are advantages and disadvantages of every route of drug administration. So you have to decide it directly whether it is useful to the patient or not useful, or maybe it may be dangerous. So the advantages and disadvantages are local therapeutic effects. The topical route provides the local therapeutic effects. It doesn't change the physiology or pathology of the patient, or not well absorbed into the deeper layers of the skin or mucous membrane because it is applied locally, or the lower risk of side effects. This is the advantages of topical route. Transdermal route offers a steady level of drug into the system. Transdermal route refers to the attachment of any drug or any patch onto the skin, which offers a steady level of drug into the system. Sprays for inhalation through the nose may be for local or systemic effects. Now the next division of local route of drug administration is deeper tissues. Like in osteoarthritis, we have introduced intra-articular injections of hydrocortisone acetates. These are called the deeper tissues because the drug directly introduced into the deeper tissues of the body. So this is called the deeper tissues, or deeper tissues is the subdivision of local route of drug administration. And the next division is arterial supply. So the arterial supply is used into the angiography. There is a dye introduced into the veins of heart so that we can diagnose the any blockage or any foreign particle into the veins. Now the oral route of drug administration. This is the subdivision of systemic route of drug administration. As you see the previous slide of that flowchart, it refers to two methods of administration. The first one is applying topically to the mouth, and next one is swallowing for absorption along the gastrointestinal tract into the systemic circulation. The advantages of oral route are, the first one is convenient. It is convenient to the patient. because it can be self-administered, it is pain-free and easy to take with water. And the next one is absorption. Absorption takes place along the whole length of GIT because in oral route we put the drug directly into the mouth and from the mouth absorption starts. The next advantage is it is cheap. The disadvantages of oral route are sometimes inefficient because very few or little or only part of the drug may be absorbed. The first pass effect means the drugs absorbed orally are initially transported to the liver via the portal vein. This first pass effect we will discuss into the detail when we will study the pharmacodynamics and pharmacokinetics. Next one is irritation to gastric mucosa. In some patients, uh, this causes irritation to gastric mucosa and which results nausea and vomiting. Next is destruction of drugs by the gastric acid and digestive juices. Effect too slow for emergencies. So in emergencies, we never use the oral route of drug administration. It is unpleasant taste of some drugs, and in unconscious patients we can never use this route. So these are the disadvantages of oral routes. Now the oral dosage forms are, these are the tablets, capsules, liquids, solutions, suspensions, syrups, elixirs, and so many more. Now here a question arises: what are the differences between liquids, solutions, suspensions, syrups, and elixirs? So it's up to you to find the differences between these liquid forms of oral doses and know about what is the main difference between the composition of these solutions and liquids which implies into these drugs. And please comment me into the comment box when you find it. So what are the differences between oral suspensions, syrups, liquids and elixirs? Please let me know. Now the systemic parenteral route of drug administration. This is the second subdivision of systemic route of drug administration. The first one was oral and the second one is parenteral route of drug administration. It refers to any route of administration that do not involve drug absorption via gastrointestinal tract. It means this route of administration bypasses the alimentary canal. So the drug is directly introduced into the into the mucosa or directly into the blood circulation. Parenteral administration is injection or infusion by means of a needle or catheter inserted into the body. This is subdivided into the injectables and other routes. Injectables include intradermal, intrathecal, subcutaneous, intramuscular and intravenous. In intradermal injectables, the injection or needle is introduced just into the dermis layer of the skin. And intrathecal, when the lumbar puncture is done or during anesthesia, the intrathecal injections are given. In subcutaneous injections, the needle is inserted into the subcutaneous layer of skin. It is given in deltoid. The angle should be 45 degree and in gluteus region the angle should be 90 degree. In intramuscular injections, the needle is introduced into the muscle, and in intravenous injections, the needle is introduced into the vein. For any doubt or query, please comment in the comment box. Thank you. In the next lecture, we will discuss about the other routes of parenteral route of drug administration. Thank you.